Hi, I'm Dr. Betty Acker, an obstetrician and gynecologist with Brazos Valley Women's Center, and I've been delivering babies at St. Joseph since 1996. I don't just deliver my patients' babies here at St. Joseph, I had my daughter here as well. You are about to tour the Women's Center at St. Joseph Regional Health Center. While watching this tour, you'll get details of what it will be like when you are in labor, and you can familiarize yourself with the steps in the labor and delivery process. Everyone who is part of your delivery at St. Joseph Regional Health Center is very qualified in what they do. Even in low-risk pregnancies, things can go wrong fast, and you need to trust who is delivering your baby. You want to be in a place that can respond quickly to you and your baby, and St. Joseph can do that. We have amazing nurses that are supportive and compassionate. St. Joseph is a wonderful and safe place to have your baby.
Every time you come into St. Joe's, whether you've come in on your own or your doctor has sent you in, you want to come in through the emergency room. When you come in, you can park in the emergency room parking lot that's right outside the doors, or you can park in the professional building lot that's just around the corner there. When you come into the triage desk and tell these ladies what you're here for, and they will get you pulled up in the computer. Hopefully you've already pre-registered. You should have done that around your 34th week of pregnancy. While they're pulling you up in the computer, they're also calling us up in labor and delivery, and we're going to come down and get you just as soon as we can. Okay, so we've come up from the emergency room where we bring you up in our secret elevator, and this is the first place that you'll stop in. It's called our exam room, and we have two of the rooms. When you first come in, we'll have you put on a gown, and it opens to the back. You'll take off everything, including your bra and your panties, and then you'll get in the bed. We'll hook you up to our external fetal monitor, and it has a two-part system. One part listens for contractions, it's called a toco, and the other part listens to the baby's heartbeat, and we have little straps that hold it onto your belly. We'll also do a set of vital signs. We'll do a blood pressure, temperature, and your pulse. And then we'll do a history. The doctor sends your office history over, so we already know a lot about you and what's been going on. But we're going to go over it with you and put it in the computer, make sure we understand everything that's happened before and your allergies. All of that takes about 20 minutes, and then once we're done with that, we'll check your cervix, and we'll check for if you're ruptured, how dilated you are, if there's any vaginal bleeding. And then with all that information, we'll give your doctor a call and tell him what's been going on with you and what we found, and then he'll do usually one of three things. First of all, he may just send you home, so you're not in labor. He may send you to walk around in the hospital for a little while to see if we can get you more in an active labor pattern, or he may go ahead and admit you. So let's assume that we admit you, and then we'd move you into one of our LDRs where we would start that process. So this is the LDR. So if you're admitted to have the baby, you would come into one of our LDRs, which is a labor delivery recovery room. And this is where you pretty much do the bulk of your labor and your delivery, unless you end up with a C-section. You're going to sign some consent forms. You're going to consent to a vaginal delivery, a cesarean delivery, a blood transfusion, and an epidural. That doesn't mean you're going to get all of those things, but we like to have the paperwork signed ahead of time. You can go over them and know what to expect just in case. And then once that's done, it's kind of, what are you looking for in your labor experience? Are you wanting to go kind of more unmedicated, you know, do some breathing, relaxation, get in the shower, that kind of thing? Or are you looking to get your epidural as quick as you can, or some pain medicine? This is the time in your labor where you choose what you're looking for, what you would like to have done, and let your nurse know, and we will help you and guide you through that. And then you just kind of labor on. You usually be checked a couple hours while you're in here. You've got, you know, a nice big room to move around in. If you want to get up and go walking in the halls, you can. You still will be wearing the monitors most of the time. If you don't have any medications, you don't have any epidural, we're not doing any Pitocin, you can come off the monitors for about 40 minutes out of every hour. But if you are getting any kind of medications or being induced at all, or an epidural, you'll need to stay on the monitors continuously, except for when you go to the bathroom. And then eventually get to a point where you're ready to have the baby, and then the room will kind of convert. We'll break the bed down into a birthing mode, we'll be doing some pushing, we'll get the warmer ready for delivery. At the very end, as the baby's fixing to come out, they'll be crowning nicely, and we deliver the baby. Then you'll anticipate spending about another hour here in recovery. Once that's done, we'll assist you with breastfeeding and getting to know your baby. We'll feed you. We'll continue to monitor you closely, and that's the recovery part of it, where we'll check your bleeding. We'll do your vital signs every 15 minutes, monitor the baby closely, just make sure everything is going well. At the end of that hour, Daddy will take the baby to the nursery with the nurse. We'll get a weight for you and a length. The baby will finish the transition up in the nursery, usually 2 or 3 hours. It just depends on how well we did good job of keeping that baby warm while we're in here, but we want to get the baby back to you as quick as we can. If you want to keep the baby with you at all times, just let us know when you first come in, and most of the time that's not a problem. Now, if the baby's having any difficulty with breathing or needs any special monitoring, the baby will have to go to the nursery. But otherwise, as long as everything is healthy and normal, which is, 90% of the time everything is just fine, the baby can stay in here and the nursery can come to you and do the bath and all of the weighing and the procedures in here. But if your baby does go to the nursery, before it leaves the room, it will be banded and it will be footprinted and it will be matched with mom's fingerprint, and she'll be banded as well. And that's before the baby even leaves the room. Once the baby makes it to the nursery, it's given another band, and it's a security band, and it's pressure sensitive. So even if somebody tries to, I'll just cut it off and get the baby that way, if it comes off, if the pressure is released, it will alarm. If it gets wet, it will alarm. If the baby with the alarm is carried too close to any of our exits that are all monitored, it will alarm, and it will bring the elevators up, open the doors, they won't go, and the doors will lock. You can't get out the stairwells. So we have really good security that way. We also all have infant handler badges that says that we're infant handlers. We get a new one every year. So you never give your baby that is to somebody who is not an infant handler. Even the doctor that is delivering your baby is not an infant handler. Once they've delivered the baby, they're done. They don't transport babies back and forth to the nursery. Somebody from lab or x-ray comes in, and they've got the white coat and scrubs, and they say, hey, I'm here to take your baby for whatever procedure. They're not infant handlers. They are not allowed to take your baby. It would need to be a nursery nurse, a postpartum nurse, an L&D nurse, or a pediatric nurse, and we all have it with our picture, and we get a new one every year. You'll get fed, you'll get cleaned up, and then we'll take you over to your postpartum room where you'll stay for the rest of your stay. Usually 24 to 48 hours, just depending on what's going on with you. So this is your postpartum room. This is where you'll come after you've finished up in labor and delivery. Usually when you come over, it'll be just you and your partner. The baby is in the nursery finishing up the transition, but we'll be coming over shortly. When you come in here, you'll transfer beds and you'll get into a nice clean bed. This bed is softer, it's much more comfortable. It's meant for recovering, and it's not meant for birthing, and our birthing beds are a little bit harder than these are. It's a smaller room because it's not a busy room. It's just a place where you'll kind of breastfeed and eat and recuperate. Plan on staying here at least 24 hours, up to 48 hours. Unless you had a cesarean birth, then it could be up to 4 days. The visiting hours are from 11 a.m. to 9 p.m. Now, when you're back in labor and delivery, we don't have those limitations. You're pretty much welcome at all hours of the day. You need to be at least 10 years of age and infection-free. So if you have a cough or a fever or any symptoms at all, you need to stay at home. Otherwise, everyone else is welcome. Now, once you come to postpartum, they do have the more limited visiting hours. Overnight, one person may stay with you. It's usually your significant other, but it can be someone else as well. And if you have other children, they are not allowed to stay overnight with you, but they're certainly welcome to come and visit you in labor and delivery and back here. When you're ready to go home, the discharge will actually occur in this room. The nursery usually does it first. They'll come in and they will verify that this is your baby with checking of the bands one more time. They'll remove the alarm that is on the baby. You'll sign some papers. They'll give you a lot of written information because you won't remember everything that they teach you, but they'll give you a lot of information to take home, some extra bottles and some extra diapers. And then your postpartum nurse will come in as well, and they will do some more discharge paperwork with you. And this is to cover you and what to expect in your postpartum recovery period once you get home. But again, all of this will be given in written information as well as verbal. You will need to bring your car seat up to the room because you will need to be checked out, making sure that you know how to properly put the baby in it and that the baby is secure. You will not be allowed to take your baby home without a car seat. So once that's done, that's the last bit of the process. Usually Dad goes down, brings the car up to the front circle, and your nurse will take you and the baby down in a wheelchair.
Of course, everyone's delivery is different, but this tour was a good introduction into what happens during and after labor. If you have any questions after watching this, visit with your obstetrician about them. You can also call St. Joseph for a personal private tour of the facility if you'd like to learn more. Thank you for watching, and we hope to see you and your bundle of joy very soon.